Welcome back. Thank you for staying with us. Ron Goddard is a member of the Mabuya Valley Minibus Drivers Association. He says members of the public should not be too quick to condemn drivers for the strike action taken on Monday and Tuesday because they have been very reasonable in their requests to the government. He has also expressed his disappointment in Transport Minister Guy Joseph and Prime Minister Alan Shasney for their response to the plight of drivers. Southern minibus drivers and some of their counterparts staged a sick-out on Monday that continued into Tuesday. In taking that stance, the drivers have come in for some criticism from some members of the public who say they are being unreasonable in agitating for government relief. Ron Goddard of the Mabuya Valley Minibus Drivers Association says, to be clear, the request was not for a bus fare increase. He says government has other options to provide minibus operators some measure of relief.
The card system would have been a thing where the government would have given us this card with a serial code behind it that they could have been scanned, and they have allocated locations for parts, tires, and fuel that we as M plate could go and get these commodities bought or purchased for these buses at a lesser rate, so that we could have continued to operate within the protocol and still be able to make something out of it, because we are getting so much discounted prices on what we basically use as wear and tear parts on a daily basis. We will not campaigning for trying to squeeze the government in particular, but we were just trying to look for an amicable solution that we could have worked within the protocol, still carry the 10 passengers as stipulated by the CMO, but be able to breathe in this situation. That's the only thing we were trying to beg for from Matt.
Goddard is also reacting to statements made by Transport Minister Guy Joseph and Prime Minister Alan Shasney on the local talk show Inside Castries Southeast on Monday night.
From what I heard coming out of Mr. Joseph and the PM, it was not encouraging from the end of it, and it didn't give me any hope that they would come to some amicable solution for us in the coming days or not, because I think Mr. Joseph even made a comment that people would have to try and pick other forms of transportation to get to work for the next week. And I didn't find that comment necessary because it was really, it was really like insensitive in a way to the bus drivers hearing that coming out of the Minister of Transport. Instead of just coming to a meeting, sitting down and talking amicably like gentlemen and seeing the way forward.
As for the claim of not following the proper channels and going through the National Council on Public Transportation, Goddard says that route has proved to be not beneficial at all.
National Council is our medium of exchange between us and the government, our representing body, and they have been doing a poor job that we find, it was my opinion, they have been doing a poor job and not representing us effectively. So we had, I would say I wasn't the one who initiated the strike, but I am a member and I would agree with my fellow members around the island, but we had to drive our point across.
Goddard says he hopes that good sense will prevail and that the sick-out will not have to continue for the entire week or longer. But if it does, he says Southern minibus drivers will continue to get the support of the Mabuya Valley Association. The chairman of the National Command Center, Dominic Fede, has indicated that a NEMAC meeting will be held soon to discuss and outline policies and protocols to guide the country during the festive season. Minister Fede says the goal is to ensure that members of the public are safe, but that they can still celebrate and enjoy the Christmas season.
The last NEMAC meeting, held on November 27th, saw slight changes to the COVID-19 protocols, which included the opportunity for the education sector to partially reopen to accommodate students who were at a critical juncture and needed to prepare for those critical assessments. Most of the other protocols remained, including the grab-and-go policy at bars and restaurants, the cessation of events including birthday parties, boat rides and beach parties, and the work-from-home order. Now, the chair of the National Command Center, Dominic Fede, says the decrease in COVID-19 over the last week or so is a good sign for the country, especially with the Christmas season, where St. Lucians look forward to the holiday cheer.
I'm getting very good news. I'm seeing the daily press releases from the Ministry of Health, and it's encouraging to see that the cases are going down. From all indications, I know yesterday there were about 114 tests which came back negative, and the prior 4 to 5 days, we have seen a low amount of cases recorded on a daily basis in comparison to what we have seen in the peak of the community spread, which we have just experienced. So I am hopeful that we're coming out of it. Christmas is going to be extremely difficult.
The command center will meet on Wednesday to chart the way forward for the Christmas period, which traditionally calls for increased socialization.
We want people to enjoy their Christmas, but we want them to also do so safely. And remember that we're still in the middle of a pandemic. And so, we want you to avoid the crowds when you're going shopping. We want you to avoid a lot of mass gatherings that would be encouraged at Christmas time. So we're just asking members of the public to be extremely cautious.
Recommendations will be made to guide the private sector, civil society, as well as members of the clergy. The NEMAC meeting will also look at those sectors which may call for adjustments for the following 14-day period. For the Hot 7 News, Nisha Charles reporting.
Chief Medical Officer Dr. Sharon Belmar-George has sought to address issues arising from the new policies instituted due to the COVID-19 pandemic. One of the issues was that of quarantine. The CMO said one of the questions posed was whether employees could take vacation leave in instances where quarantine is required. The issues were thrashed out at the 136th Annual General Meeting of the Chamber of Commerce, Industry and Agriculture.
The last we got from AG was that we could not mandate someone to take vacation leave for a quarantine, which some of the business sectors did reach out to us, where if someone is going on vacation, for example, on their own time and they have to come back in, would they be able to take that time on, because it would be a cost to the company, and added 14 days. And the final that we got from AG's chambers, where we could not mandate someone to take their time or their vacation. So it would have to be the sick leave, which we have continued doing. And also after contact tracing, we provide sick leave for 7 or 14 days based on the level of risk after their assessment in connection with the positive case.
The Chief Medical Officer also explained the management of an employee with a family member in home quarantine, isolation, or at the respiratory hospital. She said the management depends on the level of risk associated with that individual to the workplace.
If a family member has someone within their household who is on home quarantine, this should not prevent that staff member from coming to work. We've received numerous reports of persons being, businesses taking an overly conservative, and we understand the fear, we understand why some businesses would prefer if they don't come, but we need to be guided by the science. If they were in contact with a positive case, that is that they are in isolation, this person would be placed in home quarantine and not be allowed to come into work. But if it's a family member who's in home quarantine, it makes them a secondary contact. So for all first level contacts, that is contacts who have been in direct contact with a positive case, those persons will be given sick leave to allow home quarantine. But if they're a second level contact, that is they're a contact over contact, those persons would not be mandated to stay home as well.
That was Chief Medical Officer Dr. Sharon Belmar-George. A UK grandmother has become the first person in the world to be given the Pfizer COVID-19 jab as part of a mass vaccination program. Margaret Keenan, who turns 91 next week, said the injection she received was the best early birthday present. It was the first of 800,000 doses of the Pfizer vaccine that will be dispensed in the coming weeks. Up to 4 million more are expected by the end of the month. Hubs in the UK will vaccinate over 80s and some health and care staff. The program aims to protect the most vulnerable and return life to normal. Now, US regulators have confirmed that the Pfizer-BioNTech COVID vaccine is 95% effective, paving the way for it to be approved for emergency use. The Food and Drug Administration, FDA, found no safety concerns to stop the approval of the vaccine. The FDA will meet on Thursday to make a formal decision. The agency is yet to approve the vaccine in the US. In other news, St. Lucia continues to heavily depend on the tourism product. Tourism Minister Dominic Fede expressed that despite the curveballs, St. Lucia continues to do well.
By the estimation of tourism officials, St. Lucia is progressing. Since the reopening of international borders on June 4th, authorities and other stakeholders within the tourism sector have worked assiduously to ensure that visitors receive an exceptional product. Despite St. Lucia currently being rated at level 3 by the CDC, due to the rise in COVID-19 cases being seen on island, Minister for Tourism Dominic Fede has stated that the island is doing well.
We also are seeing very strong numbers from the UK, so we're very pleased about that, and we see a number of flights that are coming in. In fact, the demand is so strong that British Airways has started its daily flights from the 12th of December, and on the 27th and on the 3rd of January they have instituted 2 flights a day, which is something we have not had pre-COVID. So we're getting a flight from Manchester with Thomson Airline run by TUI, which is very critical, and we're getting a flight from Gatwick with TUI. So we're going to have about 9 flights a week consistently from the UK, where we're working very hard to market and promote the destination.
Fede says with the number of flights being booked, this spells good news for the many individuals who lost their jobs.
We're seeing on the job front a number of hotel employees have been back to work. The last count suggests that over 5,000. We have engaged hundreds of taxi drivers, both those that are carrying the TX plates and those that are with the H plates and do their trade on the internet. So we're seeing significant advancement in some of the areas. St. Lucia is way ahead of a number of Caribbean countries as it pertains to its reopening. Some of our Caribbean neighbors are just reopening.
He says majority of the hotels and villas in St. Lucia have been reopened and the government remains optimistic.
My information is about 80% of the hotels are open, and we should see some more open up in January, but about 80% of the room stock is back. We also have dozens of villas which have been open, so these are traditionally locally owned. And so that is really a very good opportunity for us as well. So we are excited by what we're seeing, the confidence that the private sector is showing, the courage that they're showing. Obviously with low occupancies would mean not good profitability. In fact, a lot of hotels are just holding the strain as we get past this rather difficult time.
Minister Fede says given that COVID-19 vaccines are going to be available soon, more visitors will be encouraged to visit the island. Reporting for Hot 7 News, I am Genevieve Gonzaga.
This is the Hot 7 TV Nightly News. Stay with us. There's more after the break.